And we are live.
Okay, good afternoon, everyone. This is September 23rd, 3:02. And as chairperson of the Jefferson County Health Department Board of Trustees, I'm going to call the September board meeting to order. Couple quick announcements. Usual attorney Christy Coleman couldn't be here today, so we have stand-in for her. Mr. Shrinu is here. Welcome to you, sir. Also, one order of business today originally was scheduled to be the annual setting of the tax rate for the health department, which we're required to do by the state every year. There was a mistake on the information that was published for that meeting. So it had to be corrected. Has to be posted at least 7 days ahead of the meeting. And so that meeting has been rescheduled for September 29th at 4 o'clock here at the Hillsborough Health Department offices. So we won't be doing that today. Having said that, again, I'll call the meeting to order. I have a roll call, please.
Mr. Deal,
Here.
Dr. Henry,
Here.
Mr. Prater.
Mr. Prater, can you hear us?
You're on mute.
He's not here. No text. No problem.
Okay.
Go back to here.
Mr. Peg,
Yes,
Ms. Davis,
Present.
There it is. It's moving.
James, can you hear us?
he said here to me on text.
Hear you, but he can't hear us.
I can hear you now. I apologize.
There we go.
Okay.
Everybody was just really quiet thinking.
Calls me again, please.
Mr. Prater,
Here,
thank you.
Okay, so we have some people here in person, some virtually, but every board member is present, so we have a quorum. So we start the meeting usually by reading the health department mission and vision. Dr. Henry, could you do that, please?
The mission is that JCHD will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision is advancing the health and safety of Jefferson County.
Okay, so everyone should have seen the proposed agenda. I have a motion to approve the agenda for today.
I make a motion, we approve the agenda.
second.
Okay, have a motion and second. Any discussion on the agenda? Okay, hearing none, the agenda is approved, so we'll proceed with that. Next item of business is approval of the August 26, 2021 board meeting minutes. Again, everyone should have gotten a copy of those in their packet.
I make a motion
Motion.
to approve those minutes.
Second.
Thank you. Okay, motion and second to approve those minutes. Any discussion on those? Hearing none, those are approved. Okay, next is approval of the August 2021 expenditures. The amount I have is, for that item is $179,331.33. And a motion to approve those, please.
Motion to approve.
I believe it was, isn't it 170,000? 331.33.
Yes.
100, it's okay, I'm sorry, so 170, 331.33, correct?
Yes.
Okay, sorry. So we have a motion second to approve that amount.
A second?
Okay, any discussion on that? Okay, so the August expenditures are approved. Approval of the August 2021 electronic payments. Hopefully I have that number right. I have $454,260.27.
So moved.
Second.
A motion and second to approve the electronic payments for August. Discussion. Okay, all in favor, please say aye.
Aye.
Aye. Anyone opposed? Okay, those are approved. And the last item to approve is pre-approval of the October 2021 electronic payments. The estimated amount for those is $583,837.25.
Make a motion to approve?
Second.
Okay, motion and second to approve those. Discussion.
Are there any, Mr. Chairman? Are there any, anything in those that are connected to the COVID or CARES Act spending? And if so, is that separate?
I'm not sure what you mean by that. Could you repeat
Do
that?
we still have CARES, I guess directly, do we still have CARES Act money that we are spending? Or is it completely gone?
It's expired. So no, we're not spending any. It's gone.
It's gone, okay,
Not available at this point.
okay. And are all of our locations all open now for regular services?
What does, this has anything to do with the line item that we're on within the agenda, sir?
Yeah, Ms.
Well,
Davis.
It would if, as you know, I mean, some of the expenses that are there within those pages would be possibly expenses from the branches, and just, you know, if the branches are just doing vaccines and we have no CARES Act money to cover that, we need to be doing regular services and not vaccines at those.
Ms. Davis, to answer your question specifically, all of our locations are providing services, and our job is to provide vaccines. We provide flu vaccine, we provide children's immunizations, we provide vaccines at all of our offices. So yes, all of the funding that we are spending at this given moment in time is for immunization services for the community.
So they're back to birth control and wellness exams for women, et cetera? At all the
Ms. Davis,
locations?
if you've been informed at each meeting since this pandemic has started, all those services continued throughout the entire pandemic. We never shut up those services completely down.
When I visited the High Ridge office, they were just doing vaccines there.
So Ms. Davis, when we
So
were
is
in the
it,
middle.
is it back to business as usual is what I'm asking?
Davis, each of the offices has been open for the services that are available at those offices. As far as the availability of services, they are based upon what has been able to be reopened at this time, whether that be vital records, family planning, whether that is immunizations. It depends upon the individual state program, whether or not the individual services have been available. But we, as far as your question for the High Ridge office, yes, we are providing family planning services, we are providing wellness services, and we are providing.
Perfect. Thank you so much.
Not all services are available all the time in all the locations.
Correct.
They were not. The other locations were just doing vaccines for a long time.
Actually, Ms.
Good to know
Davis,
they're back to normal. That's great.
I'm glad to know that you're happy about that, because again, our staff have gone above and beyond to be able to provide services to our community throughout the pandemic. And as I've said before, we've continued all services throughout and have maintained services through our mobile wellness programs and other access points in order to reduce barriers to care. So thank you for your support of those programs.
You're
Okay,
welcome.
so we have a motion second to approve the pre-approval of the October electronic payments. Had discussion. All those in favor of approving that amount, please say aye.
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 Opposed? Okay, those are approved. All right, next item is the director's report. Director Volmar.
Sorry, I was just trying to gather a couple quick extra thoughts here. A couple of updates, just in terms of our weekly COVID analysis, our update that you all receive each week was sent out yesterday with week 37 updates. We continue to be in the red status along with 113, I believe, of 115 counties throughout the state of Missouri. Our positive test percentage is 13.3%. And our 7-day total cases per 100,000 residents is still at 342.22. So again, those cases continue to climb. We had 770 new cases last week. 81.7% of those cases were unvaccinated individuals. The weekly case counts for the whole population, but as well for our youth population, continue to climb. And the cases for the 0 to 19 group, again, represent our highest percentage of increases in this past week. There were 251 total new cases for the 0 to 19 group, which is the highest weekly case count we have ever seen for this group. Last week, the weekly case count had previously been the highest we'd seen at 237 cases, and the week before at 217 was the highest we'd seen since November of 2020 during the last year's surge. Again, our children's cases are of particular concern to us because the 5 to 11-year-olds are unable to get vaccine. And so we are responsible for ensuring that there are measures around them to help protect them and to keep them safe until the vaccine is available to them. At this current point in time, we are looking at potential for EUA authorization for the 5 to 11-year-olds sometime around the end of October to beginning of November. Again, there are several steps that are part of that process, including some locally within the state. So once we get more information, we'll likely have more for you by the next board meeting. As far as our last week, we had 5 COVID deaths and 4 outbreaks at long-term care facilities. Other information to mention, as I know a lot of times people are wondering about tests, our positivity rates, normally when your number of tests increase, your positivity rates come down because you're finding more non or negative individuals than you are positive. We have seen a significant increase in the last 2 weeks of testing, which is encouraging. That's a good thing. We had 4,903 tests last week, but unfortunately we still did see an increase from 12.8% to 13.3% of our cases were positive. As far as our youth population, we are again seeing that our highest level of cases at this point in time are in high schoolers, but we have seen a recent trend of seeing our elementary school kids, particularly in the 6 to 10-year-old range, increase. The sorry. And then one of the other numbers I just wanted to share with you was last month, we had talked about the monoclonal antibody sites and the opportunity through the state to be able to have that locally here at our Mercy Jefferson site in Festus. And total patients infused to date have been 194. So the state is extremely pleased with the turnout at that site. They are at the point now they're consistently getting to almost filling it or filling their daily patient counts. So that is a fantastic resource for those who are mildly sick in order to try to prevent hospitalizations. Yes, ma'am.
Do they have to be referred by a doctor or can they
So most
go
of the
get
time,
the service?
usually you have to have a doctor's script, but if they are getting if they have a positive test, say at an urgent care or whatnot, they can be referred through that mechanism. Just in some other non-related COVID news, we have upcoming, it's October again. It's shocking to know that we are in the last quarter of another year, but it is definitely time of year for your regular flu shots. And those are now able to be scheduled at all of our offices. We are doing flu clinics, not only in-house, but also in the community. Those dates will be forthcoming, but in the meantime, we are scheduling with a couple of school districts where we go and do on-site clinics each year. We're partnering with Hillsborough, Northwest, Sunrise, Jefferson, and Grandview so far. Right now, what the limitations are in terms of staffing ability to be able to man those sites, just in terms of transition of nursing staff. We also have, the flu cost this year is $35 for the regular vaccine, and I just lost it, $75 for the high dose flu vaccine. We are participating in Project Homeless Connect again this year, and part of that is it's a one-day service for individuals within Jefferson County who are homeless. It will be October 14th this year. We are going to be providing dental services, vital record services, so individuals can get get a copy of their birth certificates, wellness services, COVID vaccine, flu vaccine, and testing. The location will be at the Arnold First Baptist Church. So we're excited to be a part of that again. And then I have a couple of flyers for you that I will pass around in just a minute when I'm done with my presentation, that we'll talk about a couple of other upcoming seminars. One of them is a parent seminar on let's talk about juvenile drug abuse, drug and alcohol abuse, which will be coming up on October 11th. These speakers are going to be from the Jefferson County Sheriff's Office Drug Unit and Mothers Against Drunk Driving. But again, we'll post this information online. I just realized that. We'll also post these flyers online so that members of the community can receive this information as well. Another speaker will be at the Jefferson College Fieldhouse. His name is Jermaine Galloway, and he will be speaking about high in plain sight. So again, talking about prevention, education, treatment, and enforcement of substance abuse. And I believe that's all I have. So thank you very much.
Mr. Chairman,
On the flu shots, people with insurance generally pay nothing, correct?
Yes, so if individuals have insurance, it is no out-of-pocket cost. And then individuals who meet certain income guidelines, is that correct with, what is it? VFC?
Yes, they have children with, who are uninsured or underinsured can get VFC. We have not received any VFC vaccine yet. There's also, we don't know if we're getting any 317 state vaccine yet for adults who are uninsured.
So there are some opportunities for individuals who are underinsured or uninsured. It just, we don't have that particular vaccine in-house yet.
Okay, thank you.
Mr. Chairman,
Yes,
I'd like to make some comments in regards to the director's report, if I may.
questions or comments?
Because I didn't want to interrupt Ms. Vollmer, so I may have some questions and some comments. Am I recognized, sir?
You have the floor.
Okay, thank you. Thank you, Kelly, for your report. We appreciate it. I noticed that you said that of the cases that you're seeing, 80% seem to be unvaccinated. That means that there's 20% faulty vaccines because people that are vaccinated are still getting sick with COVID now, and ending up in the hospital. So
Statement.
so it's not protecting them from getting COVID, and it's not keeping them out of the hospital
That's a
from having
statement.
a severe case. So it's, I do have the floor right now. So and then when I'm done, if you would like, you can question what I'm saying or ask me a question. In the PCR cases may be high, but when we follow the PCR cases, we're finding that there are mild cases, if any at all, with the children. The children are not ending up hospitalized and they're not ending up dead. And so I resent, and a lot of the population does resent, the fact that these vaccines are being pushed in these kids. Also, 5 to 11-year-olds, we don't need to keep them safe until they can get a vaccine. We need to honor and respect their natural immunities, which is very strong in children. They have a 99.997% chance of getting sick, ill, or dying from the COVID. So, moving right along here, that I just wanted that on record. The RO right now, which is the rate of infection, is under 1, which means one person to affect another person. When it gets to that point, then it's going to start dropping. We can look for that next. And the monoclonal antibodies, a personal friend of mine was experiencing some COVID symptoms. They went to get the monoclonal antibodies, and they had a terrible time with them. They're not as good as you think they are. The person was very ill with them, side effects, diarrhea, green diarrhea, and sick to the stomach, and ended up, it didn't really help them at all. It was like a short fix and then right back to the same symptoms he had. So, I just want to point that out, that's not the savior in this. The savior is taking care of yourself, building your own natural immunities, and like I have done for the past year and a half, and taking care of myself and having natural immunities. If and when I do get faced with COVID, my body's going to fight it, and I'm going to come out with the immunities, and I don't have to have a vaccine. And that's the side that we need to also be talking about, that nobody is talking about, and I'm not afraid to talk about it. So that's being mentioned on public record right now. Efficacy with the vaccines is very low. The efficacy that was promised to us with these vaccines has not come through like they said it would. They said originally there would be a 95% or higher rate with people that would not get sick with COVID. If people were told that, if you take this vaccine, you're not going to get sick with COVID. You're not going to, you're not going to end up in the hospital with COVID. You're going to be safe. You're going to be safe. Now they're talking, they're going to keep the kids safe until they're able to get this vaccine. Well, that's a bunch of BS, guys. Come on. The kids with their natural immunities are fine. They're not getting sick. They're not going in the hospital. They're not dying. And they do not need a vaccine for a 5 to 12-year-old. I'm sorry. They don't need it for any of the kids. So that's all. And I'm done.
Okay, thank
Ms.
May I
May I have the floor, please?
you. Go ahead, Tim.
Ms. Davis, do you have any sources of all the information you just laid out?
I certainly do, and I'll be happy to give everybody links. Tell me which one you want it on.
Well, you just puked a lot of information, and you really didn't put any sources to it. But
I've got sources.
I have
The
the
CDC is where I came up with the numbers.
I have the floor. Please be
Has
quiet.
the floor. You're out of order, Ms. Davis.
I was quiet the entire time you were speaking. I was respectful. I was civil. I'd appreciate the same respect to me, please. So I do have a point to make about vaccinations. They're 100% the responsibility of the person who wants to take them. They want to take them, it's their choice. Please do not interrupt me. I'm not going to tell somebody to or not to, but I will say it's like this. When you talk about immunizations, if you're going to say that no kid should get any immunization whatsoever, well, then measles will make a comeback, polio will make a comeback, MMRS, all this will make a comeback in our society. We already have measles coming in. This is through the southern border. It's a horrible situation. We're going to be inundated with a lot of diseases that we haven't seen for a while, and we're going to be in trouble. Now, I want to tell you about, don't shake your head, no, because it's happening. I want to tell you about this. When you're talking about a vaccination, it's not a cure. It's not a cure-all. It's to help your body fight off.
That's what your
The disease.
immunities do, Tim. That's what your immunities have always done.
Will you please be quiet
Davis.
together and keep them there? If your body and you exercise your body, you lift weights, you run to make it better, to make it stronger. That's what a vaccine is to help your immune system do. Really, ask all the doctors.
Not this one, not this one.
Put your lips together. Again, I'm going to ask you, please be quiet. I have the floor. That's what it's for. All these immunizations, vaccinations are to help your body and to increase its strength to fight the diseases. Now, if you don't want to and other people don't want to, that's fine. But we should make it available to everybody who wants it. And if they want it, they have the freedom to come get it. We should not stop, should not withhold it. We should offer it freely to everybody. Thank you very much, Mr. Chair.
Mr. Chairman, I'd like to answer Mr. Pick's with a little bit of a kind rebuttal.
Go ahead, Kelly.
So I have a couple of points to bring up, and we have new IT in here today, so I'm not going to ask her to try to switch out with this, but I just received a report today from our working task force who sends us the clinical updates for each of the schools, or sorry, for each of the major pandemic task force hospitals throughout the St. Louis area. And they show pediatric COVID inpatient hospitalizations have skyrocketed. Within the month of August, they've had more than almost twice as many hospitalizations as they were seeing during their worst months of the COVID pandemic in November and December and January of last year. We are seeing that our patients are right now within August, the age group most impacted was the 0 to 12 group. Last month alone, there were 126 patients who were pediatric patients in the hospital. Their length of stay is ranging from 2 to 5 days during that month. In terms of the numbers of individuals that are ending up in ICUs, we are also seeing a significant, we're seeing children who are ending up in the ICU as far as their length of stay, having shorter lengths of stay. I would like to send this to you guys, and I will send this to you so that you can see it. As far as your comment about the the RO actually within Jefferson County is 1.04 for this past week. You are incorrect as far as the region itself.
I said one. I said one.
Finishing my comment. So as far as the region, there may be portions that are below 1, but Jefferson County is above 1, which means that we are growing. As far as the efficacy of the vaccine, it has been shown to still be effective against the Delta variant. So as far as individuals who receive any other vaccine, we do not expect any other vaccine to be 100% like totally cure anything. So you receive a flu vaccine, you receive a chickenpox vaccine, you receive any of these other vaccines, there's going to be breakthrough cases in any of those situations. What we're looking for is, one, to reduce the severity of those cases and to protect the larger population. So even though we're seeing breakthrough cases with the COVID vaccine, those are expected. What we're seeing is mild cases. We're seeing those individuals are not getting hospitalized at the same rates as their unimmunized peers. And as far as the monoclonal antibody sites, You in particular were asking for other methods beyond masking and social distancing to be able to protect our populations. Monoclonal antibody treatments are another measure to be able to prevent hospitalizations and to reduce the severity of illness and prevent individuals from going into the hospital. One thing that I would advise against is looking to one magic bullet as far as what a particular remedy would be for this particular illness. So no, just as masks aren't, social distancing isn't, monoclonal antibody treatment isn't. The promotion of other things such as ivermectin and other types of dangerous chemicals that should not be ingested in individuals' bodies that have been shown on health advisory alerts from our own Department of Health and Senior Services are also things that we should not promote to our community as far as methods to safely treat the prevention of COVID or treat COVID.
Mr. Chairman, I have something I'd like to say, please.
Davis, we're not going to debate this. You had your chance to make your statements. Everyone else who wanted to has had their chance.
It's a rebuttal, Mr. Chairman, it's a rebuttal as to what Ms. Vollmer said and to what Mr. Tim, I'm not worried about what Tim said, but what Ms. Vollmer said is misinformation. And it needs to be on record as we are the health department of Jefferson County, and we should be showing both sides of this very equally, not just one side.
Have the floor. You've already had the floor. I have several comments. One is a large issue with children. COVID is that even if they may not get sick as often or hospitalized as often or die as often, they're able to transmit the virus. That's a huge problem. So you cannot discount cases among children. The other point I'd like to make is it's great for everyone to have as good an immune system as possible. I'm happy to hear you're doing your best to have a good immune system, but no one who hasn't been exposed to this virus has immunity to it. It's a novel virus. It's never been seen before. People do not have natural immunity. There's no such thing. All right. Any other comments from anyone else?
I have comment.
We're going to move on.
Mr. Chairman, your job is to recognize people to speak when you're in a meeting. And I've asked for permission to speak here, sir, according to what you just said.
On the agenda later, Ms. Davis, which is what you.
It's not related. It's not related to anything else later. It's related
That's your
to
problem.
exactly what you said.
Okay.
We're elected to represent our people, and that's what I'm doing.
That's what we're.
And there
all
is
trying-
treatment. There is treatment for COVID. And yes, SARS has been around for years. It's not something that's different. And the 99.97% of the people survived it. There was a 1% or less percentage point of people that died. And I want the truth out there, not just the fear.
Warn you one more time. You speak out of order again, you're out of this meeting. This is crazy. You talk when you have the floor. You do not talk when you don't have the floor.
I
Stop
apologize. I thought you gave me the floor.
it. All right, we have no old business. New business, approval to renew the lease for or of real property. Who's going to speak to that? Steve?
This is the lease that we brought up last meeting, and I think you asked for a little more information regarding what would happen if we didn't give them notice or if we wanted to terminate the lease. And we got our legal counsel reviewed the lease, and basically during the lease, if we would say we went out early, we would be responsible for the term of the lease unless the landlord would find another tenant. So, and once we say by October 1, we have to let them know if we plan to renew the lease. And we have to do that according to the terms of our lease that we have in place.
Okay.
How long was the lease for? A year?
It's yeah.
A year's lease.
Yeah.
Steve and I talked about this also, and he gave me some other good information. One is that location is so convenient because it's so close, so people can move back and forth if they need to. Also, it's provided another set of parking spaces that we really need. So that's helpful. Excuse me. And it doesn't appear to me that we're probably gonna need that space at least until our new building's available. We really don't have room to do those activities in any of the other offices. So I see no reason why we should not renew the lease. And I'm sorry, Shrinu, I would have asked Christie if we need a vote on that. Can you help me with that?
To approve the lease.
Yes.
And yes, was it posted? It was posted.
Yes.
Yes.
What's the cost of the lease, please?
Isn't it just to let them know that we
Yeah.
plan to renew the lease?
Yeah, but it's just a plan or no.
I think he needed something from the board to show that we are making a commitment to renew.
The landlord requested
Right.
that the board approve the notice. He wants to.
I make a motion, we give Ms. Vollmer the approval to sign the lease moving forward for another year for that property.
Second.
Okay, so motion and second to allow
Right,
the,
is that okay?
Yeah, we just gotta give him notice and then we'll sign the lease come when it's due.
and so motion and second are to allow the director to inform the landlord that we intend to renew the lease. So any more discussion on that?
Did we get a second?
Yes, from James. Correct, James?
Yes.
Okay, thanks. Hearing no discussion, all in favor of that, please say aye.
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 Opposed? Hearing none, that motion passes. We've got two items regarding setting dates for the November and December meetings. We always have conflicts those months with holidays. So I guess Kelly, could you give us our options on those, please?
So the two available dates for the November board meeting are Tuesday, November 23rd, or Tuesday, November 30th. So the day that our board meeting would normally falls on Thanksgiving this year. So they're asking you to choose either the 23rd or the 30th, or if neither of those dates are applicable or workable, then please let us know if there's an alternative date.
What week is Thanksgiving?
The week of the 23rd, I believe,
Okay,
22nd.
It's the Tuesday before Thanksgiving and the Tuesday after.
Correct.
it's usually better to have the meeting later in the month, correct?
Yes,
So would you prefer the 30th?
that would be fine.
I'm for the 30th.
I'm sorry, say again?
30th sounds good, easy to remember.
Okay. Any problems with the 30th for anyone? No. Okay, so let's go with the 30th on that. And what about December?
December, we run into the same issue again. So again, we're looking at the week of Christmas is when our normal board meeting would be. So we are trying to see if the Tuesday, December 21st, or Wednesday, December 22nd, prior to Christmas would work for any of the board members.
thinking that probably that following week, most people would be on vacation before New Year's.
I didn't know how many board members would be available that week, so
Right.
I figured before Christmas.
What
Can you
date,
count-
what dates again with that?
Tuesday, the 21st, or Wednesday, the 22nd.
Yeah, I would do it as early as possible, in my opinion. Because people start bailing out pretty quick.
So the 21st?
That's just my thought.
First sound okay to everybody?
And Christian feels like she can get the bills done by. Okay.
We should have them done weekly.
Okay, we'll go with the 21st then for December. So both of those will again be on those dates at 3 o'clock here in this office, correct?
Correct.
Okay. All right. Our last item on the regular agenda. And does anyone have anything for closed session? Okay, so. Okay, Ms. Davis, you had asked to make a presentation, so this is your chance.
Actually, I've touched on a lot of the things already. I'll just reiterate a couple more things. That basically, out of all of the cases that we've had, and the PCR cases have been proven to be faulty. Okay, they're picking up viruses and colds that people dead fragments, literally a lot of times, and that's why a good percentage of the people that have the PCR test done are not symptomatic at all. And so that explains that. And then, you know, if we don't have symptoms, we're not sick. We're, you know, this asymptomatic theory is really not really panning out, because the people that are sick with fever and symptoms are the ones that are spreading things. And there's plenty of links. There's plenty of literature out there. I can get it. Anybody wants to look at it. But the PCR tests are being faulty. We have a lot of numbers in the PCR tests, and makes the graphs go up. But in reality, you know, with any flu season at all, you're going to have people hospitalized. You're going to have people that end up with pneumonia, and the people, for the most part, with the comorbidities and age 80 and older, for the most part, are the ones that are passing when they get the pneumonias and things like that. So we need to keep that in mind, and we need to, you know, not continue to feed a lot of fear. And there are things that do help COVID that doctors in other countries are using, and there are things such as hydroxychloroquine and ivermectin, and I'm not ashamed or afraid to say it, because it is working, and they are helping people with it. And that never gets mentioned here, that people should try it. You know, it definitely has to be given in the correct dosage, you know, a tiny amount for the human body, you know, whatever that person's weight is, correctly with the doctor, you know, prescribing. But there are treatments for COVID, and they are working. They're keeping people out of the hospital, but the narratives seem to be pushing only certain things that have been used, such as remdesivir was given by Fauci as his protocol, and dextromethasone or whatever. And literally that the remdesivir is damaging people's kidneys, causing a lot of deaths in itself. And, you know, wouldn't we be much better off if we can help the people before they go into the hospital, and not just depend on, quote, a vaccine or an EUA shot that we really don't know in the future what ramifications it's going to cause people's bodies that have taken it. We really don't know. You know, it's not been tested for that long. You know, it's not a typical vaccine like we've had in the past that's helped things like polio and smallpox and things like that. You know, I'm not against vaccines. I'm against untested vaccines that are put out quickly for an emergency use. That's, you know, I don't want to be misquoted that I'm against vaccines, period. I got my vaccines when I was a kid, and my kids got their vaccines. And when I travel to another country, I get, whatever's required, the Ebola or whatever stuff they give you, yellow fever and things like that. So I'm not against vaccines. I'm just against ones that have had a lot of, with the VAERS reports, there's been a lot of adverse reactions to these vaccines. And we need to take that into consideration. And all in all, if only 1 out of 1,000 people are dying of COVID in our county, but there's more than that in adverse reactions to these vaccines and to, and in deaths. So what are we really accomplishing by pushing that vaccine? Why not, encourage people to try, talk to their doctor about other things that are working to keep them out of the hospital and keep them from getting to that point. Again, the efficacy has been not what the vaccine manufacturer said it would be. And, let's face it, folks, first it was, wear a mask, social distance, and you'll be fine. And then the vaccines rolled out. Now the vaccines, everybody that wants one has taken one, and now it's time to get another vaccine. When's it going to end? Is this real? They might have made it through the first and the second one, but they might not make it through the third one. The stuff that these vaccines are putting in people's bodies are still not proven over time, to make sure that it's not affecting people's ability to have a child, or people's blood clotting, myocarditis. It's causing, in the VAERS reports. So, that's what I want to say. I want the board to be aware that these vaccines aren't the magic pill for everything, and we need to quit walking around in fear and remember, we still have our own human natural immunities, and they work great.
Time's up. Thank you.
I have a rebuttal on the floor, please.
You have the floor, Tim.
First of all, I want to take issue, Ms. Davis, about this board, that you're thinking this board is somehow uneducated, unknowledgeable, and with that we do not know. Quite the contrary. I believe that everybody on this board understands both sides of the issue very well. As you and I have discussed before, you have a problem understanding the other side and seeing the other side, and you, as so much, told me that you couldn't defend or even argue the other side. Everybody in the room besides you can argue both sides of this. I do want to make a statement that the two drugs you mentioned, hydrochloroquine and invectomycin. Ivermectin. Well, if those get approved by CDC or the AMA,
They're approved.
They are.
They are approved. Oh, yes.
Who approved them?
But Fauci hasn't given his permission for it to be protocol, but they are approved. And they've been used by doctors already.
No, this
all over the world.
The doctor doesn't make it approved that we can say it's officially approved. It's got to be the CDC, correct, Kelly?
Correct. FDA.
So we can't. So while other doctors may use it, I understand they can do that, but we can't, as a board, come out and say yes, that's something you should do. We can't do that. That would be that's against.
We can untie the doctor's hands and let them treat patients the way they see fit.
Fine.
Like
Yes, as a board cannot
tell them they have to use remdesivir and dextromethasone.
Cannot promote that.
And see, that's where the problem is. Fauci is
99.9%
he's
safe.
making a protocol that's killing people, literally.
Again, the vaccine, the last information I saw on the vaccine, 99.9%, it was 99.9% safe.
No.
Well, that's the information.
Not even close.
Something because
a debate. Go ahead, Tim.
I relinquish the floor, Mr. Chair. Thank you.
Any other comments?
Ms. Davis, I'd just like to thank you for taking the opportunity to have our board meeting removed from YouTube again for misinformation. The last 5 minutes of your opinion that was stated to the board would sincerely appreciate to have any documentation from a credible source for the statistics that you have provided. Up until that point of time, I highly encourage individuals who were listening not to follow the advice of that one individual board member because of the simple fact that we have had a significant number of individuals who have been reported to the poison control line for the usage of ivermectin, as well as other drugs that have been promoted on social media that are not FDA approved. I strongly encourage individuals to seek valid and vetted sources for their information and to contact their personal physicians in order to get
Exactly.
accurate medical information and not follow the social media advice of individuals who refuse to look at science.
You're putting people in harm's way.
Have a motion to
Mr.
adjourn.
Chairman,
I'm
I'm being misquoted here. I do need a chance to clarify something. Just only take me a minute.
meeting.
A second.
I say that with a doctor's,
I'll wait a second.
a doctor's approval, those
The
methods
motion.
are working and helping people. And not
Adjourn.
without a doctor and not doing it on your own or trying to guess at it or dosages, etc. It has to be under a doctor, okay? That's what
Can you
I'm
hear
saying.
the motion on the floor?
Are we done?
Tim and James, can you hear the motion on the floor?
There's a motion and second to adjourn.
I said aye.
I second.
All right. Okay, adjourn. Thank you, everyone.